All right, ladies. Thanks for joining us today. Um, Layla literally needs no intro. But today, she's worked really hard on putting this together for you all to share with you, what her experience has been and how she's been able to elevate her patient's experience. And that's speaking in the chair, like how does she elevate that patient experience? So I'm going to let Layla do her own little introduction and hand it over to you, Layla.
Bobby and Erica and everyone who's taking the time from lunch and whatever time zone you're in, because I know we're all coming from every part of the United States. I like things to be short and quick. So this will probably take about 30 minutes and then I can answer any questions also. And you can also text me if you ever have any questions. But basically what I like to do is I'm a predominantly fee-for-service practice and I have to make myself unique. So patients want to pay out-of-network fees for me. So what this is in the chair, elevating the patient experience and a little bit about me. That's my family. That's my nephew underneath there, but Lucas and Nora are 8 and 4. And then David and I have been together 20 years this year. So that's a long time. And then on the side where you see the caricature, in my practice, I actually have 3 sets of caricatures over 5 years apart. And it's one of the most talked about things in my practice when patients are in my chair, because it's such a unique thing in my operatory to connect them to my family. And this artist is somebody in Oklahoma that you just send photos to, and then you give him about 6 things per person. So if you look closely, like on the TV, there's the Moneyball from Brad Pitt, because it's one of my husband's favorite shows. And then like my son's reading a Bob book and they're fighting over little things. And there's that little pink fong. So just a unique thing that sets my operatories apart. I've been practicing for over 14 years. I'm co-founder of a dental support organization, a Guiding Leaders alumni. I'm also a thyroid eye disease EDU webinar host through patient advocacy. So those are a few things about me. What I have learned is what Maya Angelou says perfectly is that people forget what you have said. People will forget what you did, but they will never forget how you make them feel. And I think that's the unique thing that I try to bring into my patients. I'm great at restorative. I'm a great doctor, but I need to make them feel and be involved in the process. So what I'd love to do is involve you guys. If you could go in the chat box and tell me one thing you guys do unique to your practice, we can collectively collect this information and make each other's experience for our patients more unique. So I'd love for you to put one thing that you specifically do that sets yourself apart from other professionals. One other thing that I tend to say is I don't compete with other doctors. I compete with myself every day just to be the best version of myself. So what we're going to go through agenda-wise is first team communication, then patient communication, and then my communication of some personal touches. And the tools that I use in my practice are artificial intelligence, dental health scans, which is digital scans of the patient's teeth, and just some personal little extras. And this is Simon Sinek's golden circles. And what he says is some people miss the why. We always talk about the what, the disease. We always talk about how you got it. Oh, you're drinking too much sugary drinks, but we're not telling them the why, like the breakdown of enamel due to your diet. And now you have to have a restoration. And now I've involved them in the why their mouth is breaking down. And you have to start with team because I can't do anything by myself. So what this says is, you guys are in my 85% of your financial success is due to personality and your ability to communicate. You can negotiate, you can lead, you can talk, but only 15% is due to technical knowledge. You've got the hand skills, you can learn all that stuff, but Carnegie Institute of Science states it's your personality that sets you apart. So that is why you have to start with your why. Oops. So the power of team communication, the team always needs to understand your why, or they try to figure out your behavior. So Joe Schaefer said it great in our meeting where she was saying, you need to tell them the why. If you don't have a clear vision, then they are confused, and then you get frustrated with them because they're not producing the behavior you want. So I always just ask you guys, what is your why? And I think sometimes we fear rejection. We fear that they're going to think we're bossy. We fear a lot of things. But honestly, if you want to be your authentic self, it's just being transparent. And if they don't want to be on board, then maybe find another job, even though it's really hard. So an example of my why, I actually change my why based on what's going on in my life. I have to ask a lot of things, but my why in general in dentistry is I believe an educated patient is a smart patient. I think smart patients make informed choices. And I think informed choices of my recommendations makes them able to understand the reason they need what they need with shared decision making. So my why is I like to walk them through what's already in their mouth. So when I recommend something, they understand the ownership is already what's going on in their mouth, not what I did to their mouth. So when you deliver the message, if you educate them, you guys are all talking about the same playbook, and the patient is understanding that. So without the transfer of trust, which is my why, I want them to have a healthy mouth. I want them to keep their teeth till they're 90. And sometimes, most of the time, I ask them, what do you want out of your mouth? And then they look at me all funny and I say, what do you want? Do you want a beautiful aesthetic smile? Do you want a functional smile? Do you want to keep your teeth? So I try to tailor my why, which is education of the patient of preventative care, to their why and collaborate together. Each of us have a role in playing this, and our team needs to understand my why so they can deliver the same message to each of our patients. So that's our team, and they have a good time. And those are my kids. We were Willy Wonka, and we try to do different and fun things together. The discovery part is important. So morning huddles and monthly meetings allows them to know if my why that month is different, whether it's our business or someone's asking for certain things, or within, if something's not within my budget, like getting an IO milling machine. So once your team understands your why, and then you transfer the trust from the front desk care team answering the phones to your dental assistant getting the records, the two most powerful communication tools that I have used recently in the last 2 years is the dental health scans with the the iTero element is what I use, and also artificial intelligence. Empowering patients in this self-discovery makes my office unique because most dentists dealt with blind trust. I no longer deal with blind trust. With dental health scans, I now can give my patients a dental health summary of what their mouth looks like before I ever touch it. And then through the artificial intelligence, I no longer have to say, do you see this gray area? Do you see this dark area? I tell them I have this unique tool to show you mapping zones of your teeth to allow you to visualize what I see. And then I explain to them the 3 layers. The first layer of your teeth is made up of 100,000 rods. And I actually use a lot of hand gestures where I like pound my hands together and I show them how strong it is. And I said, that's the hardest tissue in your body. The second layer is dentin. It has 100,000 tiny rods filled with water. And then you can see that red and pink area, that is a cavity. That shows me where your cavities are. And when it's in the green zone, you have to have it filled. Now the patient is involved in the process. When it was the gray, they couldn't really see it and it was still blind trust. So utilizing communication tools that allows the patients to be involved sets your practice apart and sets you apart from other professionals. This allows them to see the distribution. Oh, in the iTero element, I didn't take a photo of it, but most of you who use it, it shows you the occlusogram and it shows you the amount of force and space between your teeth, which helps let patients understand and start the discussion for malocclusion as a disease. Malocclusion is the most common disease that is not talked about because we always were taught that clear aligner therapy was for straight teeth to look aesthetic, but straight teeth are healthy teeth. Healthy teeth stay in your mouth longer, and your teeth and the surrounding tissues can stay healthier longer. Two ways that I set myself apart. I tell my patients I can always cut your tooth. I can never go back to keeping the enamel healthy without restorations if I cut them. So I try to explain to them the power of prevention empowers you to give you a chance to get your habits better. What I have here is silver diamond. That is now actually part of the American Dental Association's um, golden seal, where they use it for stopping decay. What it does is it goes into the tooth in the enamel, and the acidity of the tooth then gets attached to the silver. The silver acts like an antimicrobial and kills the bacteria. What then can happen, it will promote remineralization or inhibition of demineralization based on the silver still being there. Then it also breaks down the dental collagen dentin matrix, and then it inhibits the mutants, the bacteria to being eaten again. However, I tell my patients this lasts between 6 to 18 months because the acid base differences of every time they eat will then start the process over again if you don't continue to make sure that it gets remineralized. The one downfall of this is it turns it black. So as long as the patient doesn't mind it, especially in the posterior, I never do it in the anterior, then I do silver diming on several patients, even with dental hypersensitivity. The next thing, and that code for that one is D1354 for insurance purposes. This is Curodont Repair. It is the first regenerative medication, and we actually learned about it through Rella Christensen. And it's to basically, we still so new that we don't know if it works. However, I did use it on my son's 2 white spot lesions on the fronts of his teeth, and they were about a 5 by 7 millimeter white spot lesion, and now it's about a 3 by 2 millimeter white spot lesion. So I'm going to do a second round of application, and I continue to use MI paste. But the mechanism of action is a P11-4 polypeptide matrix that goes into the lesion and uses the acidic environment to attach to the tooth and then use the minerals to then build nanohydroxyapatite crystals to fill in the lesion. And I have seen anecdotally in my practice where the lesion was pink on pearl on our AI, and the lesion is no longer there. So I will say, in certain cases, when patient compliance is there and they're using fluoride daily, I can tell you anecdotally that this has worked in my practice. And to me, this is a game changer because this is actually a restorative code. So this is D2991, and it can be used for patients as a regenerative medicine medication. So this makes it unique to you, where patients don't think you're just going to drill and fill always. You actually care about being preventative. I tell them every day, I'm great at restorative. What I want to be is your primary care provider to prevent things from happening, to keep your teeth healthier longer. So, and I seal all of these, both silver diamine and Curodont Repair, with fluoride varnish to seal it in. So it at least has that fluoride absorbed in there and uses those ions. So I went a lot faster. This is not 30 minutes, but one of the things that I do is I write handwritten notes for people who are in the hospital. I write handwritten notes for people who get married. I write handwritten notes every time a new patient comes, and I write handwritten notes thanking people for referrals. I don't even know if half of them get them, but it's something that I make unique to my practice because I think snail mail is a lost art. I think sometimes if I can't get to a handwritten note, I actually give my patients my personal email address and saying, thank you so much for sending that person. It really means a lot to me. And I think that personal humanizing touch to my patients makes it a unique experience. I've done post-op calls for anybody who's ever gotten a shot in my practice for the last 13 years. For the first 5, I did them myself. And then now I have my dental assistant do it. And they think it's such a unique experience for them that somebody's actually calling after they did a procedure to check on them. And that just sets me apart. I don't know if you guys know about the last man in the iron lung, but I was actually his dentist for the last 4 years. And he passed away a couple weeks ago based on past complications of COVID. But what I want to share with you guys is after graduating from guiding leaders, it's just shared this whole unique approach to my patients and even my team of how much I now understand my why. And it's to be able to help patients keep their teeth healthier longer. And I no longer fear selling or fear rejection of, oh, she just wants to do this. I don't take that into account because I need to be telling them what they need to prevent their teeth from deteriorating. The mouth is the gateway to the body, and everything starts there from your smile to being able to function. And I tell patients, I'm here to prevent that for you. Whether you do my recommendation or not, I'm always here to fix it when you don't. And that's kind of typically how I end it. And we laugh and have a joke. So I made this longer last time for Bobby, but this is short and sweet of how to elevate your patient's experience. My last thing is takeaways. Your team has to be on board. If you do not transfer the trust, it won't build value. The value is you. They care about you. Your team is an extension of you. The doctor patient partnership is a balance of shared decision making. It takes away the anxiety of you as a provider when things don't go our way, when the patients have that decision making ability, because then now they have ownership. And then making that experience unique allows them to decide whether to stay with you or go to another provider. And I have you, lovely ladies, because you want to surround yourself with people who support you. And that support comes from external factors, but on your day to day, you are with your team more than you are with your family sometimes. So we really have to build what that value looks like. And trust and education plays such a key role in building team confidence and promoting positive patient outcomes. So I empower you guys to, take one little thing that you've learned from here, whether it's prevention, whether it's empowering your patients through digital dentistry, or just giving your patients that unique extra thank you or post-op call to give them an experience that they want to continue to see you. And I thank you for joining me today.
You're so
Oh, we
cute.
love you.
I mean, I'm not gonna lie, that was semi-awkward, but I love all you guys, so it
This
doesn't
is why we get
matter.
to do this with this group, right? Like, we are so fortunate that we have a group of women who are non-judgmental, that will sit here and they will listen to you. And if you fumble through, which you didn't, but if you fumble through something, there's no judgment about that. So I think this is a lovely place to be able to practice
I love it.
presenting. You get an idea of your speed, right? Like you realize,
Yeah,
like, oh crap, this was like a lot quicker
like that
because
was
I think,
18 minutes.
you know what? It was an awesome 18 minutes. And so I think we can all take away some things. I would love to just kind of take a look at what some of the things that our gals put in the chat about what they're doing that's
Yeah,
maybe different. Um, Let me
I don't
make
know
sure I
what
can see all of them.
yeah.
Let's see, let's start. Well, Jackie sings to her patients.
I love that.
I do too.
Yeah. So my husband, he's like, okay, so you sing and then they come back. I'm like, you know what? Be quiet. No, because I have to play music in my office. Like I can't, it's like I can't function without music. And I usually listen to 90s R&B.
Love it.
Everybody loves 90s R&B.
Yes.
And my patients always compliment, like, oh, you guys have the best music. And I will stop and sing. If it's Mariah, I will stop and put my finger to my ear and hit a high note. I don't care. And
Just
but I
picture
think
it.
the takeaway is just like, just be authentic. I'm just going to be myself, take me or leave me. And I think, that's part of being unique because so many doctors think a doctor has to act a certain way.
Yeah.
And I don't agree. I
I
just
love
think I'm
that.
just going to be myself. And if it's, I teach like some song came on the other day and it has a dance attached to it from like the 90s, and all of my staff, they're like 20 years old. They weren't even born in the 90s. And so I take it upon myself to teach them the dance. I'm like, okay, you guys need to learn this dance. So the next time the song comes on, you do it. So I just think you have to be yourself.
No,
Absolutely.
I love that. And I think that's true. One of the other things I do is I call myself Layla and humanize it. I already know I'm a doctor. I already know I'm the one who's going to fix it. And so one of my patients goes, I can call you Layla. And I'm like, yeah, I'm your doctor. But I think there's a fine balance between it. And obviously, if I was, 5 years in and still like learning, I'd have to be like gaining my confidence. But I'm here to fix it or not. And I think when I humanize myself, when things go wrong, they're just like, oh, she informed me of that. That was going to happen. I love that you sing. It says Allison does a new patient tour. Allison, you doing a new patient tour actually is unique because a lot of people don't spend the time to go show them the office. So I think that's something that's really unique for you. And what warm essential towels do you do? Is it like in a heated or?
Yeah, I get them from, of course, Amazon, Amazon.com.
Yeah.
So they're already prepackaged, and we just put them in the warmer, and I give them to patients, especially if they're very nervous. And so I just let them just lay back, and I put it over their eyes, and it really works, and it lowers the blood pressure for some odd reason. But yeah, I've been doing that.
I feel like Essie supports that. Do you have a specific scent that you do?
I like lavender.
Yeah, lavender's really nice.
Yeah.
I
Taylor,
see that Yanina has her hand up in
oh,
the chat.
Nina, yes.
Do you have a question?
Hi. Yes, actually, right now that she was talking about the hand warmers. So in my practice, for every single patient, when they come in, we welcome them and then we do the lip balm. And then after the lip balm, we do aromatherapy. And I've been trying to incorporate the warm towels, but we have this discussion with the team is like, oh my God, doctor, if we give them to them, when will we give it to them? And
Yeah.
don't you think they're going to be offended if you give it for their hands, like because you're in, so we have not, because we already do the lip balm and the aromatherapy. I've been trying to incorporate, but I don't know if after or before or what's the wording to even hand it to them, right? Because the aromatherapy and the lip balm, and then our ops are set up where we have music and every single op, so you can lower it or turn it off. So we do the lip balm, the aromatherapy, and then we ask them, would you want to watch a movie? We give them a menu, or would you like the music? So we already have three things. So I'm craving for these little hot
You
towels.
don't
I
have to
don't.
you don't have to do it for every patient because you're doing so much. But in your case, after the treatment is over, they, especially if you're taking impressions, they have impression material all over their face. Then give them a warm towel, and it's like, oh, okay.
Okay,
But
that's good
it doesn't
to
have to be for every single patient. Just kind of like just when you can see that their face is messy.
Oh, there you go. Wait a minute. And then Layla, I have another a question for you. So
Sure.
when you say that you do follow-up calls, what is the specific wording that you use? And the reason why I ask you this is because I do follow-up calls possibly 70% of the time, and more we did OS or implants. But when my team makes the follow-up calls, they're like, oh, Dr. Juicy, I kind of felt like they were like, what, should something be wrong? And that's why like where you're calling me. So
Oh,
so what would be the wording?
so
Because I don't get that perception, but because I have the relationship with the patient, right?
yeah.
But when my team has done it, I said, huh.
So my dental assistant, so when I call them, I would say, hi, Erica, it's Dr. Lohmann. I was just calling to check up on you after your procedures to make sure everything felt okay after the numbing went away and answer any questions that you may have had when you went home and you were unable to ask me while you were numb. Most of the time I left voicemails, and then if they answered the phone, they would tell me, and then I would write it in their chart. I always documented whether I left a voicemail or I wrote, it felt great, or I think I'm hitting it tall. And then I'm like, not a problem. I'll fit you into my schedule tomorrow. What work time works for you? And we'll adjust your bite. My dental assistants say, Hi, Bobby. It's Priscilla from Dr. Lohmann's office. I was just calling to check up on you to make sure you were feeling okay after everything woke up. Oh, I hate that thing, that new thing with it's like, sorry about that. But let me rephrase it. She goes, "Hi, Bobby. It's Priscilla from Dr. Lohmann's office. We're calling to check up on you after your procedures today, just to make sure everything felt okay after it woke up. If you have any questions, please don't hesitate to call us and we'll fit you in if you need it." So it's very short and sweet, not that like, "Hey, are you feeling okay?" Like, I don't even do an open-ended question. I just say, "We're calling to check up on you after your procedures today to make sure everything felt okay once you woke up." Because if I ever don't numb them, I don't call those patients. I only
Okay.
call patients that get numbed, because then they always are like, one unique thing that I do when I numb anybody is I tell them, you'll never feel right on the side that I'm numbing because your tooth is asleep. So I want you to pay attention to your right side. Does your right side feel normal? And they're like, yes, but my left side doesn't. And I said, great. Your right side fits like a puzzle piece. If your left side was too tall, there would be space. So I will do a post-op call. I actually, that's a good question. I pre-tell them someone's going to call and check up on you tomorrow.
Got you.
So
Okay.
that's another thing that I do. So I'm glad you asked that question, because I say, Priscilla's going to call you tomorrow to check up on you to make sure everything feels okay, so that you don't have to worry to call us if you have a problem. And that like means that like they feel like I care about that procedure, but it just sets myself apart. It's a great
Yeah, yeah,
question.
and I love that because then you're kind of setting the expectation, like wait for my call, like it. So when you call, it's like kind of like normal because you already told them, right? Yeah, okay, perfect. I love that.
Yeah.
Awesome. Thank you.
I love that you set the expectation. I like that. That was a good one. Um, Taylor says, "I try not to talk to them during their treatment when they're laying down. I sit them up and then discuss any treatments or concerns." Do you feel like that's worked really well?
Can you hear me? I've been having issues with my mic today.
We can hear
Okay,
you.
good. Yay. Hi guys. Yeah, so in when I was in dental school, I was a dental assistant on the side and I temped in a lot of offices. And like a surprise, and you guys might not do this, but a surprising number of dentists talk to their patients about their treatment, like while they're looking in their mouth. And it's so weird. And it always was so awkward to me when they would do it. And so that was just something I've always done ever since dental school, is I just find patients appreciate it. They're never like intimidated. They always ask me questions, where I feel like a lot of times I felt like after the patient left the room, that the patient would then ask me a bunch of questions about their treatment because they felt almost like intimidated by the doctor, like speaking above them or on top of
Yeah,
them. So
I
that's
love
just
that.
something I've always done. Yeah.
I love that. And I think it connects with them when you sit with them eye level. So to your point, like you're not overpowering them, but you're like with them. And I think it
Yeah.
feels like you're shared in that. That's great. Thank you for sharing that.
Yeah.
Liz, you do handwritten notes too. Is there anything else you have done that's unique?
Well, as you were talking, hi everyone. I was thinking there are several things that we do that are on the list. We use chapstick for sure. Also, we write cards for a lot of things. We have a whole box of cards. And so everyone in the office has permission. They can go get a card at any time and they can sign it, or everyone can sign it. But if there's a loss of a pet, we have special cards for loss of a pet. If someone's healing from, or, is sick, just I've done lots of different things. You get to know your patients really well and they appreciate any little card they might get. And like you said, the snail mail, they love it. I had a patient who used to live on Catalina Island, and he told me, he's like, when I moved back to Colorado, I knew I was coming to this office because you had me from the handwritten note.
Oh, that's
So
really
it's just, yeah, it was sweet. So I think that those things are great. We don't do the aromatherapy, but I'm really considering that because I think it's a very good way to calm people down if they have anxiety. But
and
yeah,
just
really just
sure,
knowing our
some
patients.
people do have sensitivity, so ask them beforehand, because sometimes
Sure.
the
Yeah,
asthmatics like myself would be like,
mm.
"Oh, I'm dying."
Oh, yeah, no, that's a great point. No, I appreciate that. That's really good. And we do the follow-up. We do follow-up texts. So we don't call, but that we have just the texting. So usually, the assistant that is on the day after the procedures is in charge of reaching out and just saying, just checking in on you, hope everything's good. Please let us know if you have questions. So there's a few things like that that we do. And I think it does make a big difference. We don't do any outside marketing, or we don't spend money on marketing. So those things we really rely on our referrals a lot.
Oh, that's awesome, Liz. And Jackie, you already said you educate everyone about malocclusion because they often don't understand why their teeth and mouth are breaking down. And it's sometimes the position of their teeth. So you are very right.
Well, it's like they always are like, no one has ever explained it to me like that before. Because they're like, I do everything, and how come I keep having to have crowns and all this stuff? And I'm like, well, look at the way that your teeth come together.
Yeah.
So when we do our exam, like I first go over their medical history. I'm like, hey, I just already glanced at your medical history. These are the things that you replied yes to. Do you mind if we go over them? And so we do that. And like we have questions about like snoring and whitening and straightening and all that stuff. So it already starts the conversation. Then we move to the iTero scan. And I was like, okay, well, and I always say something like, oh, I've always wanted to like take my patient's mouth out of like their teeth out of their head and show them so you can see exactly what I see. And like, look at this technology. Now I can do it. And they're like, this is so cool. I can see my whole mouth. So then we go over everything on the scan. And then I go over x-rays and then I look in their mouth. So we've talked about like so many things before I even lower them and look in their mouth. And then I said, if anything changes that we haven't seen, I'll let you know. But like this is what I already know. And I haven't even looked in your mouth yet. And they're like, whoa. So yeah, I just like education and like you mentioned if I was 5 years out, I'd be scared or nervous to say everything. But like as you get more into this profession, you just realize like, look, I'm your doctor. My job is to help you have the best, mouth that you can have, the best experience that you can have. And if you don't want to hear it, that's okay. But it's my job to tell you.
I think that's what Liz and I talked about yesterday. We were talking, and we are primary care providers of the mouth. And sometimes we're just like, you're a dentist. Oh, I'm still your primary care provider of your dental oral health. If you did not have teeth, you would not be able to function and or eat. And so I think sometimes we go in and being like checking those recalls really quickly. And those are those opportunities where you're like, let's do this dental health scan. I just got this tool to help you see the view of the dentist, and I want to inform you and empower you to know your mouth. You're not going to win everybody over, but it's going to make you have that unique experience. And also it reduces the anxiety of you having to sell. Like they can see the cracks, they can see the retarded, they can see the recession. And Allison, you asked about, I use Pearl AI, but there's also Overjet. So any artificial intelligence, in my opinion, is not reduce your critical thinking ability. There's a lot of things that don't go right with AI where they see a lot of radio opacities and radiolucencies that are either cervical burnout. So I considered a second opinion. What's really unique about the AI experience is they have like a pink dot, a blue dot. So when you do your recall exams and you're going to go do a quick glance of like what the x-ray looks like, it alerts you like, hey doc, take a second look at this x-ray. It does not diminish and or tell you to do a filling on a tooth. That is your critical thinking choice and decision-making ability. And I think what people are concerned about is AI is taking over. No, AI is helping you be better. So when you know, do your best that you can. And when you know better, do better. And AI has been able to catch radiolucent opacities, radiolucencies at apexes that I would do a quick glance and not even look at that like 0.5 millimeter radiolucency. And so I can tell someone like, hey, did you get hit in the face recently? And they're like, yeah. And I said, I think your nerve is slowly dying. Let me take another x-ray real quick. And then you can see why they need it. And then they can see the blue shadow. So I think the AI component is increase my case acceptance because they can understand it and I no longer have to sell it. And it's been really
And psychologically, people, they like to look at a screen and they believe the red boxes on the screen. It's crazy. Like it takes it, they'll say, what's that big red box on the screen about? I mean, it really speaks to them. And I love the iTero work you guys have done. We actually sold an Invisalign case because we had done a night guard for this gentleman. And then he said that the night guard moved his teeth and he didn't like that. So we brought up the scan and we said, well, here's your teeth when we did the night guard. And he's like, wait, they were that crooked? We're like, yeah. He's like, well, what do we need to do to fix them? So then he went into Invisalign, but he could see it on the scan because we had the scan available. And he hadn't put two to two together. He thought the night guard moved his teeth. So it's very powerful when they can see it themselves.
I agree with you. And then the last thing I'll plug in is the Cure Don't Repair. If you have any questions about silver diamine or Cure Don't Repair, it is an adjunct to help your hygiene program. It's something that you it's something the dentist does not have to do. But it's also something that builds value in trying to not replace enamel, but to save enamel. And so those are two things that people don't necessarily think synonymous with dentist. They think dentist drill. And so I think that would make your office a little bit more unique of offering preventative services to keep your enamel healthier longer. And then we all know that they're going to go keep drinking that coffee, which will still feed the cavity, which will then still need their filling and or crown later, just because that's just life about eating. So if you have any questions about either one of those products, I use them regularly. Thank you for coming.
All right. I love this. You guys got a chance to talk to each other again.
It's
Oh, I
fun to
get
see
some
everyone. Happy
faces. I
Easter.
know. I hope everybody has a happy Easter. And y'all have Layla's contact information. She is always willing to chat with you guys. If you need some recommendations on any Netflix shows, she's also very good at that. Um,
It's like really bad, you guys. Netflix. Mhm. Yeah.
I wanted to say too that I just started on my braces journey like a few months ago, and I wish I would have had a dentist like you guys that connected with me as much and on the level that you want to with your patients. Um, I had my first iTero screen at my first like braces consult, and that blew my mind, like seeing all of that, because I have been a program manager in the past, but have never been in the dental field. So all of this is very new to me. So when they brought that system out to me, I was like, what? That's so cool. Let's blow. Like I want to like print it out. I want to show my husband and like take it to my friend. But I love the lip balm idea because I freaking cover my whole face in Vaseline. You guys get in my mouth so much, and that's a great idea. But yeah, I just wanted to say that I really appreciate all this.
I
As
love that feedback, Erica, because it's
Yeah.
true. That reaction right there is like everything. Like, thank you for involving me. You're like, you're welcome. Now, do you want to do the, clear liners? It's gonna be $5,300. Thanks.
Yeah. Like, can you like show me what you're doing for me to like give you that money? I would
That's
appreciate
right.
it.
That's right. Well,
I
thank
love
you.
that Erica has that perspective that we don't normally get. So thanks for sharing, Erica. That's awesome.
Mhm.
All right, ladies, happy Easter. Love you
Bye.
all.
Happy
See you all next
Easter.
one or sooner.
Bye. Thanks, guys. It's
Bye.
so nice seeing you.
Good to see you too.